Newlife IVF is one of the leading IVF Greek clinics offering the full range of fertility investigations and treatments, including a very successful egg donation program. Our superior experience with international patients, along with our high pregnancy rates, makes us one of the most popular IVF clinics abroad. Our philosophy here at Newlife is that our patients' wants and needs are our priority. We aim to offer high quality of care pre and post-treatment, high success rates, and safety is of paramount importance. Our medical and laboratory facilities are sophisticated and kept up to date. We follow strict guidelines in order to provide high quality of care, high success rates, and safety. We fully appreciate how difficult it is to pursue fertility treatments abroad. For this reason, we have put support together to be able to help you throughout the process, before and after treatment. We try and make Newlife a home away from home. Since every patient's problem is unique, so are the treatment plans that we follow. We offer realistic options in order to maximize your success. Here at Newlife, we offer low-cost treatments, and every patient will know from the start till the end what the final price will be without any hidden costs. Greece, and Thessaloniki in particular, is an excellent holiday destination. Thessaloniki as a city has many things to offer. It has a rich cultural heritage, great shopping, fine dining, a really nice place to be, so where better to start a family?
When we talk about fertility, we mean the ability to have children. Infertility is the inability to conceive following 12 months of unprotected sexual intercourse, or 6 months if the woman is over the age of 35. Getting pregnant requires many factors working together properly in both man and woman. Timing is critical, and a healthy sperm needs to meet an egg through an open passageway, the tube, where fertilization takes place, and then the fertilized egg returns back into the uterus where it is implanted. When all these work properly, conception is successful in about 25% of the time. Unfortunately, infertility is fairly common. It affects around 3.5 million in the UK, which is around 12% of the reproductive age population. Infertility is not just a woman's problem. A male factor is solely responsible in about 20% of the cases, and it contributes to another 30 to 40%. There are many cases where no causative form can be found. This is named unexplained infertility and affects around 25% of the couples. Here at Newlife, we always focus on a couple's problem rather than an individual's issue. Apart from basic infertility treatment options like ovulation induction and intrauterine insemination, our clinic mainly focuses on treatments like IVF and ICSI. IVF, or in vitro fertilization, is a technique where we fertilize the woman's eggs with a partner's or husband's sperm in the lab. Usually, we perform this technique when other treatment options have failed or when the tubes are blocked. ICSI is a technique where we inject a single sperm directly into the egg. Usually, we perform this technique when the sperm count is very low, or where in previous IVF cycles there was a very poor or no fertilization. In the vast majority of cases, there is a surplus number of embryos following these treatments. We have the ability to freeze these embryos for future use. This is done by a technique called vitrification. The freezing process does not affect the quality of the embryos, and they carry the same chances of pregnancy like with fresh embryos. Third-party reproduction using another source of sperm, eggs, or embryos may be the only option when these are not biologically possible by a couple. Our unit mainly specializes in treatments like egg donation. IVF with egg donation is the option of choice in women whose ovaries cannot produce eggs, like in cases of premature menopause, or in cases of women of advanced reproductive age whose ovaries tend to produce low quality of eggs. The Greek law states clearly that egg donation is anonymous and all donors are of young age. They need to be screened for specific diseases like STDs, infectious diseases, and also screen that they have normal chromosomes and they're not carriers of genetic diseases like cystic fibrosis. In our unit, we recruit donors younger than the age of 30 and of proven fertility. This means women who have already a history of a pregnancy in their past. We also try to match the physical characteristics of the donor and the recipient as much as possible, and also their blood groups. By doing all this, we end up having excellent pregnancy rates in the area of 65 to 70%. In about 85% of our cases, we have surplus embryos remaining which can be frozen for future use. This gives us the advantage that if the first treatment cycle is unsuccessful, we can embark to a second treatment cycle without the need of recruiting a new donor, or the best case scenario, if the treatment is successful and the couple wants to come back for a second child, by using the frozen embryos, we can make sure that the offsprings are genetically brothers or sisters.
I've been married for 15 years and it came as a shock to me finding out that I could not have babies. A friend of mine suggested a Newlife clinic in Greece, and we decided to combine our summer vacation with getting treatment, consultation, and trying to see if our dream can come true. So we visited Greece, we came to Thessaloniki, and we were so happy that we did, because Newlife Clinic and the staff was really above our expectations. They were very helpful with us, explaining the reasons why we couldn't have babies. They assisted us with all the paperwork involved in Greece. And finally, they were very supportive with the emotional part of the whole process. Now, the treatment itself took just 15 days. It was painless, and the staff assists you every single day during the whole process. We are happy parents of 2 healthy baby boys, and it was worth the journey, and I highly recommend Newlife Clinic to every couple that is trying to conceive.
For those patients who are eligible for fertility treatments in the UK, the NHS provides good treatment and care. However, there are many couples who do not fit the criteria for NHS funding or have been unsuccessful so far. For these people, the only way forward is to use the private sector, and prices in the UK are quite high. Newlife offers a different solution. We provide excellent quality of treatment and care at a much lower cost. We put our patients' safety above all. We're responsible and careful healthcare providers. This means that when our patients complete their treatment with us and go back home, there will be no extra burden on the NHS as a result of the treatment with us. We aim to communicate personally with each patient. We want to know our patients' stories. All our staff speaks English fluently, and most of us have been trained and worked in the UK or other European countries. We offer extra services such as longer office appointments, personal email correspondence, free Skype consultations, and 24/7 availability to all our patients coming from abroad.
For those people coming for fertility treatments from abroad, we know how difficult it is. For this reason, we have a support system and dedicated staff on board in order to help you at every step of the way. Apart from the normal clinical and medical staff, we have psychological and nutritional support, acupuncture and aromatherapy in order to help you. We know that there are many clinics out there offering similar techniques, but we believe we have something different to offer. For this reason, if you're having natural problems conceiving, please contact us and let us help you begin the journey of making your dreams come true.